First tonight, Texas hospitals swamped with an ever-increasing number of COVID-19 patients are facing a new challenge, having enough doctors and nurses on the front lines to help care for them. KXAN investigator Kevin Clark asked healthcare experts about the changes hospitals could make to their staff as this crisis evolves.
A video posted by the Travis County Medical Society reflects urgency about the spike of COVID-19 hospitalizations.
Today, our nurses and doctors are stressed, but they are hanging in there. If this surge continues, in 3 weeks, they'll be overwhelmed.
Hospitals under Ascension, St. David's, and Baylor Scott and White said 76% of their staffed beds are occupied, with 85% of ICU beds being used. 2 weeks ago, just 70% of those ICU beds were filled.
When you're at 90%, even 85%, you're really tight, because that means you may have a bed available, but is that the bed the patient needs?
These are the challenging decisions Dr. Sydney Zolnarek says hospitals will increasingly have to make. Zolnarek is CEO of the Texas Nurses Association. Like many states, she says Texas hospitals are required to create their own staffing plans in case of a large influx of patients. Internal documents shared with us by local hospital workers say that some hospitals are increasing their staffing ratio, adding more patients per nurse. As a result, Zolnarek tells us hospitals may choose to supplement their doctors and nurses with temporary healthcare employees from different parts of the U.S.
Some hospitals are looking at team-based models where you may stretch the number of patients that an RN may care for, but you supplement that nurse with other providers.
Zolnarek says she knows St. David's hospitals are bringing staff to Central Texas from within the company. We had asked St. David's about how many employees it was bringing. The healthcare provider declined to give specifics. CMO Ken Mitchell said in a statement St. David's is working to rapidly increase nursing and support staff, including paying staffing bonuses. Kevin Clark, KXAN investigates.
A spokesperson for Ascension says some staff at Dell Children's will be redirected to help the local COVID-19 hospitals. They said 20 healthcare staff members traveled to Austin from around the country to help out at Seton, Maine. Do you work in a hospital here in Central Texas? Do you have coronavirus-related concerns the public should know about, but your bosses might not want getting out? Well, the KXAN investigators are digging into those problems. You'll find a secure form to send us a tip at kxan.com. Just click on the coronavirus tab. That's where you will find all of our hospital-related stories.
Today's updated COVID-19 numbers from the state show almost 9,700 Texans hospitalized. While it's still a record, it's only up 79 in the last 24 hours. That's the smallest increase in more than a week. There were also 105 new deaths today. That is a new one-day record.